My name is Rashida Nesbitt. I am a F&P student at Maryville University. I am doing a HIT2 assessment for my advanced health assessment class. Tarika is my volunteer for my patient today. Before coming into the room, I had Tarika empty her bladder and change into a hospital gown. I obtained height, weight, and vitals, and we also did the vision screening on the Snelling eye chart. So to begin my assessment, I'm going to do an inspection of her head. I'm going to check for the symmetry of her eyes, make sure her nose is midline, make sure her ears are symmetric for her head shape. I'm looking at her scalp to make sure there's no lesions at the moment that I can see. I'm also going to have her, clench her teeth, smile, puff out your cheeks, raise your eyebrows for me, lower your eyebrows, stick out your tongue. Alright, so, and frown. Then I'm going to palpate her scalp, make sure her scalp moves freely across her skull, which it does. Looking for, see if there are any open lesions, see if the scalp is dry, overly oily, see if there's any hair loss, thinning hair. Then while I'm palpating her scalp, I'm also going to start checking her lymph nodes. So first I'm going to check her occipital. Then I'm going to check the post-auricle. I'm going to check the posterior cervical. I'm going to do the superficial cervical. I'm going to go up and check the pre-auricle. I'm checking more cervical. I'm going to check the tonsil, the submandible, submental, and I'm checking facial bones. I have an opener mouth, but I check her temporomandible joint. Close your mouth for me. Thank you. I'm also going to palpate her auricles while I'm palpating. Also, I'm going to palpate her sinuses. Let me know if you feel any pressure or any pain, tenderness. And then I'll check her lacrimal apparatuses. So while your eyes are closed, don't let me open them, okay? All right. Thank you. So next, I'm going to listen. I'm going to look into her ears. Alright, so I'm going to have you tilt your head to the side for me. I'm going to pull the auricle back and up and back. When I'm looking in the ear, I'm looking for the tympanic membrane, looking for the light reflex, which I see. Alright, thank you. So I'm going to go around to the other side. I'm looking to the other ear. Alright, looking for the light reflex, which I see. Thank you. So I'm going to have you cover your right ear for me. I'm going to whisper a word to you and you repeat it back to me.
Mickey Mouse.
Alright. So I'm going to cover your left ear. I'll whisper a word to you again.
Sunshine.
Alright. So then I'm going to do the Weber test. This, I'm going to hit the tuning fork and place it in the middle of your head. I want you to let me know if you hear it in both ears or more on one side than the other. Alright. So, next I'm going to do the rain test. With this, I'm going to strike the tuning fork again. This time I'm going to place it behind your ear. And then I need you to let me know when you don't hear it anymore. Then I'll place it in front of your ear. And you'll tell me again when you can't hear it anymore. With this test, we're testing air and bone conduction. I'm going to start with your right ear.
Okay.
So we're going to do it again on your left.
Okay. Okay.
Right. So next, I'm going to look at your eyes. I'm going to look at your pupils. Show me it. Have you looked down while I look at your conjunctiva? Check and see if your membranes are moist. Just squares to make sure they're nice and clear. Then we're going to check your nose. So, do me a favor, go ahead and breathe in and out for me. One more time. Okay. So I'm gonna have you close your eyes. I'm gonna have you smell some things for me. And this is going to check your cranial nerve for smell. Alright, take a deep breath for me. Did you smell?
Alcohol.
Alright. Take a deep breath. Alright. Thank you. Next, I'm going to take a look up your nose. Check and make sure your membranes are intact, not swollen. Mucous membranes are intact and dry, and moist. Mm-hmm. So I'm going to have you open up wide. Sit up. I'm looking at your mucous membranes, looking at your teeth, looking at your gums. Lift your tongue to your roof for me. Make sure there's no lesions, no cuts. Make sure all your teeth are have good dental hygiene. I'm gonna have you say ah for me. I'm looking at your uvula. Look at your tonsils. Check your vagus nerve by having you gag. I'm sorry. I'm sorry. Then I'm gonna have you close your eyes, and I'm gonna check the sensation on your face, and just let me know if you feel what do you feel when you touch your hand? Alright. So I've checked cranial nerves 1, 2, 3, 4, and 6. By checking your eyes with the extraocular movements, I had you gag, which was number 10. Sorry again. It had your sense of smell, which was number 1. Actually, number 2. I'm gonna look in your eye and check your red reflex, which will cover your eye nerve. Alright, look straight ahead for me. For your eyes. So I need you to follow my finger. Only my finger. Okay? Alright. Look straight ahead, cover your eye for me. Uncover and cover your left. Uncover. Alright. Let's check for nystagmus to make sure you're constant. Alright. Okay. So next we're gonna palpate again. So I'm gonna move down your neck. Go back some more lymph nodes. Continue down your cervical chain. 1, 2, your supraclavicular lymph nodes. Move into the, move this down a little bit. Your infra, clavicular, into your axillary. And then check for your trachea, make sure it's midline. Check for your thyroid. I'm gonna be swallow forming. Thank you. And check for your carotid. Alright. So then I'm gonna be turning your head to your left. Right, don't let me push it. Thank you. Turn it to the right. Don't let me push it. Thank you. And then we're gonna listen to your carotid and your thyroid. So next we're gonna move on to the chest and pull you down a little bit. Okay. And down to around your knees. So I'm looking at your chest. We're gonna assess, the rise and fall. We're gonna check your respirations. Make sure it's not labored. Make sure not labored. Make sure that it's symmetric. I'm gonna check for your expansion. So go ahead and take a deep breath for me. Alright, thank you. Just check your expansion. Make sure your lungs are expanding equally. Alright, I'm gonna check your pulses, your radials and your brachials. To make sure nice blood flow. Your arms are nice and warm. No edema. So next, I'm gonna percuss. Toss the arms up. I'm gonna go on the back and percuss and check for diaphoretic expansion. First I'm gonna percuss. Just your lungs. Okay, so first what I'm going to do is you take a deep breath and hold it, okay?
Okay.
Alright, whenever you're ready. Alright, hold up. Thank you. Okay. So you're going to do that again, okay, when you're ready. Good. So this time, what you're going to do, you're going to take a deep breath, you're going to let it out, then you're going to hold it.
Okay.
let it breathe. Alright, so you're gonna do it one more time. Take some regular breaths. I know that's a lot. Alright, breathe. Alright. So diaphoretic expansion should be between 3 and 5 centimeters. And she is in between those, which is great. So I want to check for expansion also. Take a deep breath for me. Alright. And yeah. So while I'm back here, I'm going to go ahead and listen to your breath sounds. Lean forward for me. Take deep breaths. And lift your arms for me. Deep breath. Deep breath. Deep breath. Breath. Okay. So I'm gonna go ahead and have you say 99 while I'm here. 99.
99.
99.
99.
99.
99.
God bless y'all. 99.
99.
99.
99.
99.
99. 99.
Thank you. So go up to the front and listen to you in the front. You want to check the strength of your arms.
Okay.
So maybe raise your arms up to the side. So while you have that, don't let me push you down. Don't let me pull them up. Alright, I'm going to the side. Don't let me pull them up. Let me push them in. Alright, up. Don't let me pull them out. Don't let me push them in. Alright, put your hands up. Don't let me push them down. Don't let me push them up. Switch fingers. Don't let me close them. Push fingers. Don't let me open them. Alright. I'm going to check your reflexes. Alright. So, first we check ready. Alright. Ready. Shoulder, shoulders. Don't push down. Alright. So, I'm gonna have you go ahead and lay down for me. Get you a little comfortable. So, looking at the belly or the abdomen. Checking for any obvious masses and lesions and skin discoloration. Hair distribution, any old scars. And then we'll go ahead and listen for vowel sounds. To the cusp for little border. So first it's going to be light palpation. So let me know if you feel any pain and tenderness on the belly. So first is light palpation. Feel for any masses. And deep. Kidney. Sorry. I don't say deep palpation, but I'm sorry. Go ahead, you can put your gown back on. Go ahead and sit up for me. We're gonna move on to legs. Lifting muscles, start with your joints. So, looking at your legs, check for edema. Checking for the temperature with your legs is really warm. Look for any discolorations, any open wounds, pores, anything out the ordinary. If she doesn't have any. We're gonna check pulses. Okay. Cells pierce. Refill. One check. Reflexes. Push down on my hands, push up against my hands, push out against me, pull back against me. Alright, you lift your knees. Alright, check your knees and hips. Alright, so I'm gonna have you, before you stand up, do two things,
Okay.
and then have you get up and do some walking for me. So, close your eyes for me. So I want you to put two things in your hands and just tell me what they are.
Take your time.
Alright. And what's this one?
Corn. Down.
Yes. Thank you. And close your eyes for me. I want you to tell me whether or not you feel sharp or soft and where you feel it. Okay?
Sharp on my left leg. Sharp near my right knee. Soft on my left knee. Soft on my right hand. Sharp on my left arm. Sharp on my right arm.
Alright. Alright, so I'm gonna have you stand up for me. So I'm gonna have you walk with one foot in front of the other and towards the end of the bed for me. What's up for you?
Okay.
Exposed. Okay. You got
Regular walk.
oh, one foot in front of one foot right in front of the other. And a tandem walk out. Using your balance and coordination. So you're gonna turn. You're gonna walk back on your tippy toes. So I'm gonna have you bend to your left and work the weights. Get out the stop. And bend back as far as you can. And turn to your side and bend forward. And check this. Make sure everything nice and straight. Thank you. Okay. So I want you to touch my finger, touch your nose. on and
Oh.
increase your speed.
Okay.
Alright, switch hands. Alright, thank you. And this concludes my head to toe assessment. Thank you.